welcome to STI News. I'm your host, Sydney Salyer, and today we'll be talking about two different types of STIs. The first one we're going to start out with is HSV, also known as herpes. So herpes is a virus that is not curable. So once you have it, you will be stuck with it. There are two different ways to kind of see if you do have herpes. You can have a blood test, which isn't always very accurate because it doesn't tell you exactly where the herpes virus is located. And then sometimes it's just based off your symptoms and where you have the lesions. So symptoms and complications that you may have, you'll have lesions, as I mentioned. You can have a fever, and you can also have enlarged lymph nodes. The way that it is spread is through contact with the infected area. So that could be oral, anal, or vaginal sex. It can also just be genital to genital contact. So the only way to prevent herpes is to not come in contact with the infected area. That does include when you use a condom to be cautious because the condom doesn't cover everything, so you could still end up with the herpes virus. It's treated by using a suppressive treatment and an antiviral medication. So we'll also have a special guest today to discuss syphilis. So off to you, TJ.
Thanks, Sydney. Next up, we're going to talk about syphilis. Syphilis is a curable bacteria that is spread by vaginal sex, anal sex, oral sex, and genital to genital without penetration. Some symptoms and complications are cankers, which is a painless lesion that appears the site of contact, spirochete, which is a spiral-shaped bacterium, and treponema pallidum is pretty much what causes it. The way to prevent syphilis is safe sex and contraceptions. The way to test for it and the diagnosis is a dark field microscope exam and a blood test. And it is treated by penicillin.
It looks like TJ might be having some technical difficulties, but there you have it, guys. You have your two STIs that you now know how to prevent, the symptoms that will occur, and ways to treat it if you do end up having it. And from myself and TJ, we hope you have a great rest of your day, and this has been STI News. Thank you.